I'm Ioanna Gkika. I'm a psychologist working for the Smile of the Child. I'm working at this organization based in Greece for the last 7 years. And I'm also coordinating the Center for Internet Safety of this organization. But what is the Smile of the Child? As you can imagine, it has to do with child protection, and it's the biggest organization in child protection in Greece, running for 30 years. And it has a really strong story that I would like to share with you so that you can also understand what this organization is about. It all started 30 years ago with a kid. The name of the kid was Andreas. This child got brain tumor. It was a really sensitive child. At the age of 10 years old, he started noticing all the bad things that other kids were experiencing around him. He could see kids begging in the streets. He could see kids being alone, abandoned in hospitals, victims of abuse, waiting for their next day to come. So he decided to write on his diary what he would like to be created so that these kids could be helped. So he wrote that we should all be united and we should all try to help these kids have food and family and shelter and their rights and their toys and people that they care and they love. And he went on a TV show with his family. He spoke as much as he could in his own way about his dream, about what he had written in his diary. And he didn't manage to stay alive. He didn't manage to fight back this difficult medical condition he was dealing with. He lost his life. But right after, the organization was started. He was the founder of the organization. So 30 years ago, and having this diary as, let's say, the starting part, a huge universe started creating, because nowadays the Smile of the Child has supported more than 2 million children and families all over Greece, supporting kids that they have issues with abuse, missing kids, kids that they're dealing with medical issues and conditions, and also kids that they're dealing with poverty. So it's really important that for our organization, we're really trying to give voice to the children, and we're really trying to put them in the center, and all the adults around them should be listening to them and trying to make them feel more safe. So actually what we're doing is many different things. We're running hotlines, national hotlines for kids. We are really working on prevention. We're running strategies and campaigns on schools. Every day psychologists go to Greek schools and they try to talk with children, teachers and parents about many different issues that they have to do with the school community, such as bullying, internet safety, any kind of violence, resilience, and many different topics. And what we're also doing is that we are intervening in crisis, in any different kind of crisis that they might happen, related to schools, related to community, related to any context that a kid could be included. So we're really trying and we're really adjusting according to the needs of the society. And of course, we could not do this if we were not in real contact with organizations all over the world. By exchanging good practices and trying to be updated, in touch with them, and also participating in projects like these and others that they're focusing on creating a more, let's say, normal and more concrete way of dealing with issues that they have to do with kids' safety and children's protection in general. I'm going to share a typical thing that it might happen through the national helpline that we have in Greece, running by the Smile of the Child. So many things kids are going to call there, and they're going to start talking, not mentioning what exactly is happening, but just trying to reach someone, psychologist, social worker, and start talking about it. So the first sign that we really notice to kids experiencing abuse within their families is that they think that this situation is a normalized situation. It's something normal. It's something that happens in every family. And that's because they've been growing up in family that this is the way of dealing with issues, let's say, exchanging shouts, exchanging curses, exchanging abuse in any different kind. So the first step is that to make them understand that there are also other ways that they can communicate, and this is not the normal way. And of course, just because children take the responsibility on them, as we know, many times they think that they are the reason for parents, let's say, abusing each other, experiencing violence, or creating this story. So one of the first signs is that they consider it to be normalized. Then we have many different signs that they come either from the children themselves or from the people being like surrounding them, teachers, carers, in many different ways. They might be sleepy, let's say, at school, or they might be scared of other kids. They might be isolated. They might see changes in their everyday life. What we really recommend is that whenever you can observe a kid having a major change in his healthy routine habits, you should definitely keep an eye on it and try to understand what's going on. So there are several signs that we can notice. These signs have to do with, as we said before, with feelings changing, the psychological condition of a child. They have to do, of course, with the physical violence, any signs on the body, but you can also see definitely signs on behavior, and you normally have to do with socialization and the way that they interact with other children. And then another thing is that children do not trust adults, and this is something that really has to do with adults not being the people that children want them to be around them, just because they think that if they share the story, the teachers or the carers are going to get angry, are going to ask them why did this happen, why they haven't talked till that moment, or what do you want them to do. So another sign is that feeling that they are in a dead end, that they cannot share anything, they cannot talk about it, it's not allowed, and they should just stay patient and try to figure out what's going around them, in a sense. So what we normally do is trying to make these kids feel empowered so they can share the story, and of course do not tell them lies like this is going to finish now, things are going to get better for sure, or that parents, let's say, or carers are going to be away for the next days or so, because sometimes when we're trying to make a kid feel safe, we might have this thought of saying something like completely, let's say, not based on reality. So what we're trying to tell them is that we're going to be next to them and we're going to try to support them so that they can feel safe again. And this is a process that it's not a universal one. It's really different compared to one story or another, because every call that we get on the whole line is completely different from another one. So it really has to do with the special characteristics of that specific story of the child. And this is also something that we should all consider as a good practice. We cannot deal with every case in the same way, because there are many different aspects that they make it a whole different story. And of course, it has to do also with the personality characteristics of the child. When we have to do with a child that, let's say, is dealing with disabilities or with any kind of fears, or what's the age, what's the context of this story. So first of all, we try to feel more safe and to make them speak. Many times we explain them what's our role and what we're doing and what is this hotline about. And it's really important because kids trust us when they realize what it is about. We have 500 to 600 calls per 24 hours per day, and more than 200 of them, they're coming from the kids themselves. So this means that they feel safe and they try to use it more. And then the process has to do with adjusting to the different needs of the child that we have, let's say, on the phone or on the physical interaction when it's needed. What we really recommend is trying to give them a person that they can talk to. Try to tell them that there are also other people around them not experiencing the violence, that they're here to listen to them. And this, of course, can be the people working for the Smile of the Child, but they can also be their teachers, they can also be other family members, can also be their friends, or other people that they can trust. Because many times they think that the only people they can trust are the parents, let's say, and when something is happening within the family, they feel that they cannot talk to anyone. And what happens in many cases is that the parents also communicate with us, and we all trying to find the solution, because we can see that violence happening in a family does not mean that the child should definitely get out of this family or should be separated or so. We're really trying to teach this family, in a sense, different ways of communication, non-violence communication, more of active listening, and other ways so that they can improve. We should always contact official entities in Greece, try to force a little bit more this family to do what's supposed to do, so that child feels safe again.